Inflammatory bowel disease, or IBD, should not be confused with irritable bowel syndrome, or IBS. Inflammatory bowel disease is generally thought of as Crohn's disease and ulcerative colitis. These are inflammatory conditions of the bowel that cause changes in the mucosa of the bowel, including ulcers, bleeding, and other inflammatory changes. Crohn's disease can occur anywhere from the mouth to the anus. It can occur in skip fashion, so you can have one area of bowel that's affected, then another normal area, and then another area that's affected, whereas ulcerative colitis is continuous inflammation beginning in the rectum and extending upwards and only occurring in the colon. IBS is a description of symptoms that affect patients. Generally, it's abdominal pain associated with alternating diarrhea or constipation, but it can also be diarrhea predominant or constipation predominant. Inflammatory bowel disease is an inflammatory condition of the bowel where the immune system itself is attacking the bowel and causing changes in the mucosa, ulcerations, bleeding that is the cause of symptoms, whereas irritable bowel syndrome is the collection of symptoms that are typical without any underlying abnormality in the bowel mucosa. So there is no inflammation, there's no ulceration, there's no bleeding. It is a big difference from inflammatory bowel disease.